So Korea has been doing these discussions about HIV and aging for how long now?
Well, it's certainly been a number of years. I first met the folks at Korea when I was working with SAGE, which is the LGBT senior advocacy organization here in the U.S. And they had done a report together, and it was the first report about older Americans with HIV. And they debuted the report and released it at the American Society on Aging conference. And it was really incredible because no one up until that point had really been talking about older people with HIV. I mean, in this country, we barely talk about older people as it is, and especially older LGBT people. It's like we kind of fall off the side of the face of the earth at 40, right? So I had done a lot of work with SAGE and through them met Korea, and you know, I just think that this kind of research and this kind of advocacy and the training they do is so important because it's what makes change in institutions and what makes change in communities. It empowers people, it educates people. The visibility in the media is vital to help people understand that there are affected populations beyond the ones that we've seen the most visibility for.
A lot of the existing efforts right now still focus on prevention. And we tend to forget that, again, you know, that people with HIV are already aging as well. So
yes.
What can you say about that?
That is right. And that's something that I think really only in the last few years we've started to see organizations that not only work on HIV, but that work generally on health issues start to say, wait a second, I now have a patient who is in his 60s and 70s and I'm dealing with all these other issues related to aging and health, intersecting with the fact that this person is HIV positive or has AIDS. And so it's really forced a larger medical community to acknowledge that we need to start looking at the issues of long-term survivorship, and you know, prevention is obviously incredibly important. Prevention is actually treatment, you know, in many ways, but learning how to adapt to an aging population with HIV is critical, and that treatment piece is just is absolutely vital.
And what about internalization of the going international with the practices that we have in the U.S. like? In the travels that I have, it tends to be the Western countries that actually lead with discussions on HIV and aging, but a lot of Asian countries, including the Philippines, for instance, there's still that neglect of including the aging population as far as discussing HIV is concerned.
You know, from the beginning, and I've been an activist at the LGBT, HIV communities since the early 90s, and we've seen a real sea change in terms of people being willing to discuss. You know, not just around HIV, but generally around these issues, discuss people over 50. I mean, it's just, you know, we're such a youth-focused culture here in the U.S., so it took a long time for us to do it. So I'm not surprised that it happens in other countries as well, and that just the same kind of advocacy needs to be done as we've done here for years. That we're finally starting to see, I think, some real success in not just the visibility, but the kind of campaigns that Korea's doing, the kind of research they're doing that really is the underpinning of changing the way the health community and the medical professionals really look at AIDS.
Okay.